It's the new year, and you know what? I think we're approaching a new phase in COVID and COVID treatment. Hi, I'm Dr. Brian McDonough. Now, that's very simplified. We have a signpost on the road that says New Year. Now we have a new approach. But I actually think it's important because I saw a study this morning, which I thought was very impactful. You know, Omicron's sweeping through our country. New York's one of the first places it hit. And I saw where 94% of hospitalizations thus far are being prevented by having the vaccine. Now, that's fantastic news if you've been vaccinated. It's not great news if you're not. But here's why I think it's important. The first thing is our healthcare system has been overburdened, but if Omicron continues to work this way and we have the percentage of people who've been vaccinated, it will not get burdened any more than it has been. Where we see the burden right now is in our emergency rooms. People coming in to be tested. If they have sniffles, they want to find out if they have COVID because they don't want to go anywhere and spread it. That's actually very responsible. But the problem is there are lines going into emergency rooms with people wanting to be tested and people with chest pain can't get in. The issue then is probably the same mistakes that have been made since the beginning of the pandemic. Why did the government and others not have literally billions of tests available despite the fact that there have been warnings? We had press conferences over a year ago. Unfortunately, our healthcare system seems to react as opposed to look forward. That's why we didn't have enough masks at the beginning and why people couldn't have masks on the street because they had to save them for the hospitals. Now we're in a situation where we don't have enough home tests. I don't know what to do about that, but right now you got to get those tests out there so the emergency rooms are less crowded. Think about it. The healthcare system will not be burdened more than it has been in the past, and things might get better because we know that the only people being hospitalized by and large are those who are not vaccinated. Selfish way of looking at it from a standpoint of public health, we know that if you're vaccinated, by and large, you won't get hospitalized, you won't die. You can get pretty sick, but you're not going to be hospitalized and die. Take that information and run with it. If we run with that information, the next step is doing everything you can to inform people who aren't vaccinated what the numbers say, the risks, and what they should do. But those conversations now have to be done one-on-one. I can tell you as a broadcaster, I had 2 decades when I would say things and there really wasn't another voice in my town. I was the person. And in those days, if you gave out public health information, it was the official information. With social media, everyone has an opinion. So you're not going to give good information, bad information. It's all the same in social media. What I'm saying can be said the complete opposite by someone else somewhere else. And you're not going to get a million people. You might get 100 or 200 people or 2,000. You're not going to get the reach you used to get. So the bottom line here is this has to be done one-on-one. But where I feel comfort as a physician is this is what I've been used to in my life. I'm used to talking to people and telling them not to smoke 2 packs a day and telling them it for decades, knowing and warning them that they could get respiratory problems, lung cancer, or die as a result of smoking. And sadly, I've accepted that because I know people make their decisions. Same thing with, do you wear bike helmets if you're a child? Do you wear seatbelts? Do you drink and drive? All of those things are information we've based with experience over time and knowledge. We're at that point with COVID. We're at the point where you need to make your own choices now. If you make your own choices, you live with your choices. As a physician, it makes me feel no better, but it doesn't make me feel guilty anymore. I felt guilty because I couldn't reach enough people. I now know the vaccines are out there. People can get them. They have access everywhere. I know that the knowledge is out there if people choose to accept it. And I know that people are making their decisions. You can't ask for more than that. So ideally, what we're seeing is a weakening of the virus to the extent if you're vaccinated, you have protection. We'll probably have vaccines for many years. We're still going to have to be very careful, especially now, to avoid unnecessary risk because we've got a lot of people under the age of 5 who are not vaccinated. And finally, we have to try to come together as a country and have reasonable conversations looking at where we've been, where we're going, and hopefully working together.